Hi, this is Dr. Chan with Crown Dentistry. We're getting a lot of questions about how our oral health affects our overall health. So today we're going to be talking about that, and hopefully we can shed some light on the subject. So one of the first things that we want our patients to remember is that everything that happens inside your mouth affects the rest of your body. That means that if you're healthy inside your mouth, your teeth are healthy, your gums are healthy, your tongue's healthy, then it's going to be good for the rest of your body. Conversely, if things aren't healthy in your mouth, maybe you have gum disease, maybe you have some cavities, it's going to negatively impact the rest of your body. One of the biggest places that it can affect is your heart. So everybody knows that we need to exercise and eat right in order to keep our heart healthy and minimize the risks of heart attacks and stroke. What we also need to remember is that we need to keep our mouth as healthy as possible in order to minimize the risk of heart attack and stroke. One of the biggest things that we want to prevent happening is that our patients get gum disease. So gum disease happens when bacteria, which are already present in our mouth, are allowed to thrive and basically take root above and below the gums. So when we see our patients, we check them on a regular basis to make sure that not only are the teeth healthy, right? Are there no cavities, but also are the gums healthy? Because if gum disease is present, that means that there's more bacteria in your mouth than there should be. And that bacteria can increase the risk of heart attack because in your heart, there is a number of blood vessels that need to stay as clear and clean as possible. When they start to fill up with either fat from the food that we eat or bacteria, it restricts the blood flow, and that can cause your heart to die. And that's what can lead to a heart attack. So we want to try and minimize the amount of bacteria infection that's in any part of your body, but especially in your mouth. So there have been numerous studies done by universities across the country and the world linking gum disease to many kinds of cancer. Studies have shown that an increase or even just a slight presence of gum disease can increase the risk of lung cancer, colorectal cancer, head and neck cancer, breast cancer, cancer of the pancreas. And sometimes increases can range anywhere from 20% all the way up to 50%. So we definitely want to make sure that our patients don't have gum disease. And if they do, we want to do what we can to try and help them eliminate it. So diabetes is a disease that some people have that basically negatively impacts the effect insulin and how it controls your sugar level. So insulin is normally produced, at least in a healthy patient, in the body, and it's a substance that helps you control how much sugar is in your blood. Patients that have diabetes either can't produce that insulin or they have a hard time utilizing the insulin that is produced. So when your mouth is full of gum disease, if it is, it will negatively impact how your body can utilize insulin. And if you have diabetes, it'll make it even harder for you to utilize the insulin in your body. Also, what can happen is that gum disease can impact the fact that, a lot of times patients that have diabetes have decreased immune system response. That means they don't heal quite as well. So if you have gum disease, it's a lot harder for your body to fight it off. And so we want to make sure that we keep that under control. So we always tell our patients it's always important to have good dental care because you want to make sure that your body is as healthy as possible. If one of our patients is pregnant, they're not only taking care of their own body, they're also taking care of the body of their new baby. So we want to make sure that anything that's in their mouth is as healthy as possible because we have to remember, even though the baby is being grown down in the patient's uterus, we also know that things that are happening in their mouth don't just stay in their mouth. It can also affect the rest of their body, which means that it can affect what's going on in their baby. So if a patient has gum disease and they're pregnant, there's a chance that they're passing on that bacteria, that infection, to their fetus, to their baby. So we want to make sure that that doesn't happen, and we want to make sure that they're staying as healthy as possible, not just for themselves, but also for their baby.